1. The periosteal arteries are derived from A. A major artery passing near the bone. B. Anastomosis around the joints. C. Nutrient artery of the bone. D. Muscular arteries of the muscles attached to the bone. E. Metaphyseal arteries. Option D is correct, muscular arteries of the muscles attached to the bone. 2. Which of the following belongs to the diarthrosis variety of joints? A. Gymphosis. B. Synchondrosis. C. Symphysis. D. Synovial joints. E. Sutural joints. Option D is correct, synovial joint. 3. Which of the following function as resistance vessel? A. Elastic arteries. B. Muscular arteries. C. Arterioles. D. Venules. E. Capillaries. Option C is correct, arterioles. 4. The acrosome reaction occurs, A. When the spermatozoa are traveling through the uterine cavity. B. Just before the penetration of corona radiata. C. When the sperm cell membrane comes in contact with the corona radiata cells. D. When the sperm cell membrane comes in contact with the zona pellucida. E. When the sperm head has penetrated through the zona pellucida. Option D is correct, when the sperm cell membrane comes in contact with the zona pellucida. 5. The lining of the primary yolk sac is called A. Amnion. B. Epiblast. C. Somatopleuric extraembryonic mesoderm. D. Chorion. E. Husser's membrane. Option E is correct, Husser's membrane. 6. Which of the following is a derivative of mesoderm? A. Lens of eye. B. Pituitary gland. C. Mammary gland. D. Enamel of teeth. E. Cortex of suprarenal gland. Option E is correct, cortex of suprarenal gland. 7. The largest bundle of commissural fibers in the brain is called A. Anterior commissure. B. Posterior commissure. C. Habenular commissure. D. Corpus callosum. E. Fornix. Option D is correct, corpus callosum. 8. The inferior horn of the lateral ventricle extends into the A. Frontal lobe of cerebral hemisphere. B. Temporal lobe of cerebral hemisphere. C. Occipital lobe of cerebral hemisphere. D. Dencephalon. E. Midbrain. Option B is correct, temporal lobe of cerebral hemisphere. 9. Tectum is a part of A. Dencephalon. B. Midbrain. C. Pons. D. Medulla oblongata. E. Cerebellum. Option B is correct, midbrain. 10. In each posterior gray column of the spinal cord, the group of neurons lying just anterior to the substantia gelatinosa is called A. Nucleus dorsalis. B. Nucleus proprius. C. Visceral afferent nucleus. D. Accessory nucleus. E. Lumbosacral nucleus. Option B is correct, nucleus proprius. 11. Which of the following structures take part in the formation of the roof of fourth ventricle of brain? A. Superior colliculi. B. Inferior colliculi. C. Pineal body. D. Superior medullary velum. E. Facial colliculus. Option D is correct, superior medullary velum. 12. The primary motor area is located on the A. Precentral gyrus. B. Postcentral gyrus. C. Middle frontal gyrus. D. Superior temporal gyrus. E. Middle temporal gyrus. Option A is correct, precentral gyrus. 13. Which of the following cell components is not surrounded by a membrane? A. Lysosomes. B. Microbodies. C. Mitochondria. D. Nucleus. E. Nucleolus. Option E is correct, nucleolus. 14. An example of the stratified squamous non-keratinized epithelium is constituted by the lining epithelium of A. Trachea. B. Urinary bladder. C. Esophagus. D. Stomach. E. Conjunctiva. Option C is correct, esophagus. 15. Production of antibodies is the function of A. Fibroblasts. B. Plasma cells. C. Histiocytes. D. Mast cells. E. Fat cells. Option B is correct, plasma cell. 16. The connective tissue covering of a skeletal muscle fasciculus is called A. Glycocalyx, B. Perineurium, C. Perimysium, D. Endomysium, E. Periosteum. Option C is correct, perimysium. 17. The cortex of a lymph node contains A. Lymphatic nodules, B. Cords of Billroth, C. Periarterial lymphatic sheaths, D. Venous sinuses, E. Hassel's corpuscles. Option A is correct, lymphatic nodules. 18. Which of the following cell types performs a phagocytic function in the epidermis? A. Merkel cells, B. Langerhans cells, C. Keratinocytes, D. Melanocytes, E. Monocytes. Option B is correct, Langerhans cells. 19. The intercalated ducts of the salivary glands are lined by A. Tall columnar epithelium, B. Low cuboidal epithelium, C. Simple squamous epithelium, D. Stratified squamous epithelium, E. Stratified cuboidal epithelium. Option B is correct, low cuboidal epithelium. 20. Von Ebner's glands are found A. On the soft palate, B. On the lips, C. On the cheeks, D. On the tongue, E. In the wall of esophagus. Option D is correct, on the tongue. 21. The esophagus is lined by A. Simple columnar epithelium, B. Simple cuboidal epithelium, C. Simple squamous epithelium, D. Stratified squamous keratinized epithelium, E. Stratified squamous non-keratinized epithelium. Option E is correct, stratified squamous non-keratinized epithelium. 22. The muscles of the tongue are derived from A. Myotomes of cervical somites, B. 1st pharyngeal arch mesenchyme, C. 2nd pharyngeal arch mesenchyme, D. Protic myotomes, C. Myotomes of occipital somites. Option E is correct, myotomes of occipital somites. 23. Which of the following muscles is a derivative of the third pharyngeal arch? A. Mylohyoid, B. Tensor tympani, C. Stylohyoid, D. Stylopharyngeus, E. Cricothyroid. Option D is correct, stylopharyngeus. 24. Incomplete fusion of the two medial nasal swellings results in the production of A. Oblique facial cleft, B. Median cleft of upper lip, C. Lateral cleft of upper lip, D. Macrostomia, E. Microstomia. Option B is correct, median cleft of upper lip. 25. The medial one-third of the superior nuchal line gives origin to A. Splenius capitis, B. Trapezius, C. Sternocleidomastoid, D. Semispineless capitis, E. Occipital belly of occipitofrontalis. Option B is correct, trapezius. 26. Which of the following structures passes through the mandibular foramen? A. Inferior alveolar nerve, B. Mandibular nerve, C. Lingual nerve, D. Mylohyoid nerve, E. Hypoglossal nerve. Option A is correct, inferior alveolar nerve. 27. The superficial temporal and maxillary veins join to form A. Posterior auricular vein, B. External jugular vein, C. Retromandibular vein, D. Internal jugular vein, E. Angular vein. Option C is correct, retromandibular vein. 28. The medial branch of the dorsal ramus of C2 spinal nerve is known as A. Great auricular nerve, B. Greater occipital nerve, C. Lesser occipital nerve, D. Auriculotemporal nerve, E. Posterior auricular nerve. Option B is correct, greater occipital nerve. 29. The skin of the angle of mandible is supplied by A. Auriculotemporal nerve, B. Mental nerve, C. Infraorbital nerve, D. Great auricular nerve, E. Zygomaticotemporal nerve. Option D is correct, great auricular nerve. 30. The deep facial vein connects the facial vein to A. Cavernous sinus, B. Tragoid venous plexus, C. Internal jugular vein, D. Maxillary vein, E. Superior ophthalmic vein. Option B is correct, tragoid venous plexus. 31. The investing layer of deep cervical fascia splits to enclose A. Thyroid gland, B. Hyoid bone, C. Arch of aorta, D. Parotid gland, E. Submandibular gland. Option D is correct, parotid gland. 32. Which of the following muscles lies in the floor of the posterior triangle of neck? A. Scalenus anterior, B. Scalenus medius, C. Sternocleidomastoid, D. Trapezius, E. Sternohyoid. Option B is correct, Scalenus medius. 33. The posteromedial surface of the parotid gland is related to A. Masseter, B. Ramus of mandible, C. Temporomandibular joint, D. Styloid process, E. Branches of the facial nerve. Option D is correct, styloid process. 34. The postganglionic secretomotor fibers reach the parotid gland through the A. Glossopharyngeal nerve, B. Greater petrosal nerve, C. Lesser petrosal nerve, D. 35. The sensory root of the facial nerve is known as A. Cauda tympani, B. Nervus intermedius, C. Lesser petrosal nerve, D. Greater petrosal nerve, E. Nerve of tragoid canal. Option B is correct, nervus intermedius. 36. Which of the following is a deep, medial, relation of the lateral tragoid muscle? A. Ramus of mandible, B. Maxillary artery, C. Sphenomandibular ligament, D. Superior pharyngeal constrictor, E. Stylopharyngeus. Option C is correct, sphenomandibular ligament. 37. Which of the following muscles assists in the elevation of the mandible? A. Lateral tragoid, B. Medial tragoid, C. Digastric, D. Genohyoid, E. Mylohyoid. Option B is correct, medial tragoid. 38. The taste sensation from the posterior one-third of the tongue is carried by A. Cauda tympani, B. Lingual nerve, C. Hypoglossal nerve, D. Glossopharyngeal nerve, E. Inferior alveolar nerve. Option D is correct, glossopharyngeal nerve. 39. The lymphatics of the palatine tonsil drain into A. Postauricular lymph nodes, B. Occipital lymph nodes, C. Retropharyngeal lymph nodes, D. Jugular-digastric lymph nodes, E. Jugulo-omohyoid lymph nodes. Option D is correct, jugular-digastric lymph nodes. 40. Which of the following is a branch of the maxillary nerve? A. Zygomatic temporal, B. Supratrochlear, C. Infratrochlear, D. External nasal, E. Buccal. Option A is correct, zygomatic temporal. 41. The lymphatics from the tip of the tongue drain into A. Submandibular lymph nodes, B. Submental lymph nodes, C. Parotid lymph nodes, D. Jugular-digastric lymph nodes, E. Jugulo-omohyoid lymph nodes. Option B is correct, submental lymph nodes. 42. The lateral wall of the infratemporal fossa is formed by A. Lateral tragoid plate, B. Tensor palatini muscle, C. Zygomatic arch, D. Ramus of mandible, E. Carotid sheath. Option D is correct, ramus of mandible. 43. The posterior auricular nerve is a branch of A. Cauda tympani, B. Great auricular, C. Facial, D. Auriculotemporal, E. Accessory. Option C is correct, facial. 44. The medial surface of the thyroid lobe is related to A. Longus colli, B. Superior pharyngeal constrictor, C. Carotid sheath, D. Recurrent laryngeal nerve, E. Sympathetic trunk. Option D is correct, recurrent laryngeal nerve. 45. The superior meatus of nose contains the opening of A. Anterior ethmoidal air cells, B. Middle ethmoidal air cells, C. Posterior ethmoidal air cells, D. Maxillary air sinus, E. Frontal air sinus. Option C is correct, posterior ethmoidal air cells.